Welcome to My Dental Hygiene School Experience, hosted by Dach Ska. The world of hygiene school can be wild. Hold on to your toothbrushes because we're going to dive into the chaos right now.
What's up, dental nerds? This is Dach Ska, dental assistant, dental hygiene student, and future hygienist. Today is an interview. I know I haven't talked about semester 5 yet, and it's just gotten really busy, so I decided I'm not going to do that yet. It's probably just going to be one episode where I talk about what happened in semester 5 and what all the classes are and all that. So anyway, so the interview today is with Drs. Mattox, Dr. Matt and Krystal Mattox, and so they talk a lot about ergonomics and stuff that potentially could shorten your career if you don't use them properly. I mean, we learn proper instrumentation, proper ergonomics for that, so we don't wear out our hands. There's also proper chair placement, proper everything. So they kind of go into more detail about that stuff. For this interview, the audio quality on my end was actually terrible, and I think it was because of the earbuds that I was using, and I thought they were okay, and I should have tested it first, so that was my bad. I apologize. Luckily, they do most of the talking, so you don't have to listen to it too much. I tried my best to change the audio so it sounds a little better. It just kind of sounds like I'm on speakerphone or something. Anyway, so just ignore it. Just get the information. Don't worry about what I'm saying too much. But it was a great interview. I reached out to them. Well, I followed them on Instagram. They reached out to me. We were chatting back and forth, and I did mention to them how what I mentioned on the podcast before, how I injured my knee just from one appointment where I had bad ergonomics. I was standing and leaning, and it just I think it permanently damaged my knee. But anyway, we'll talk about that in the interview a little bit. But I'm just going to let them do most of the talking. But anyway, here's the interview.
All right. Well, welcome. I have Drs. Matt and Krystal Mattox. You talk a lot about ergonomics and stuff like that. So introduce yourselves, kind of tell me all of what you do and how you got there.
Absolutely. Well, thank you, Dash, for having us on your podcast.
Yes,
so
thank you.
I'm Dr. Krystal. I am a dentist. I graduated from the University of Maryland School of Dentistry, and currently we live in Virginia. So I work as a general dentist at a community clinic, and this is my husband, Dr. Matt, who is a physical therapist, and together we form In Alignment.
That's awesome. And I was reading on your website a little bit about your story, how you kind of created In Alignment. Do you want to talk about that a little bit?
Yeah, I'd be happy to.
Your favorite story.
I know. Yeah, because it's real. It's real. I mean, and you understand this too, Dash, because student loans is real. You know, that for me was really the motivating factor. So I graduated dental school with over $300,000 of student loan debt. And I know it varies for different people depending on specialties. And then obviously you with hygiene, like it's just a lot of money, right? And on top of that, with, physical therapy school, so Matt started physical therapy school when I ended dental school. So we were cash flowing that. So it was just a lot. And I am very I don't like debt. I want to be out of, especially student loan debt. So I was very adamant about it. So between the two of us in 2022, we had 6 jobs because we were we had our main jobs, but we were moonlighting at different places to let's just knock it out. And that was the goal. And we achieved that goal. But in the process of doing that, I really messed my body up because I was doing dentistry 6 days a week. And I really don't think that this profession, as physically demanding as it is, that's the best for your body, especially when your ergonomics and posture are not ideal. And that was me. Dental school, I think we had, can't even say semester, we had an hour or two of a class lecture that talked about ergonomics. And then in the preclinical lab space, they would watch us and how we were sitting. but nothing serious. It was just a dentist. It wasn't a physical therapist or somebody who really understood posture and ergonomics. They were just kind of giving us their opinion on things that they had heard before they were just regurgitating. So you have so many other things that you're thinking about sometimes. If it's not front of mind, you're just trying to get through your day, right? So that was me in dentistry. I was working at a fast-paced office, rare delivery system, which means that everything was behind me, all my instruments. It was a lot of turning, a lot of twisting. Sometimes I was working by myself without an assistant. So, so it was just a lot going on. So with that, I was coming home begging for massages from my husband, a physical therapist, and he got sick of me. So pretty much. No, he was gracious. He was just kind of like, what is going on? So he decided to come and venture in the world of dentistry and see what I was actually doing. And that's when he was like, oh no, like there's no amount of massaging or exercising and stretching that I can give you. We have got to get to the root, right? We talk about a lot in dentistry, like let's get to the root of what's going on, so that we can really help you, get out of pain. So that was exactly what he did. And from then it just helped me so much. I started talking to some of my friends and people I graduated with, and we started helping them, just helping them. And from there, it just blossomed because people were getting better. They were feeling better. And that's when we started In Alignment. Obviously, there's a dental pun there and a physical therapy pun there. But I think it's been just such a great journey. Anything you want to add?
No, I mean, you summed it up pretty well, I'd say.
All right, cool.
So, Dr. Matt, I just wanted to ask you on the physical therapy side of things, what did you notice going into Krystal's dental office? What are some common things that you would see in a dental office that would not be good for our posture or, just overall our body?
Yeah, some of the things that I would see the most commonly, whether it was when I was going to see Krystal at her office or even when I've gone in person and done analysis on other offices, a lot of the time, I will say the number one issue with a lot of people in their ergonomics is actually just having very poor postural awareness. And what I mean by that is that, as Krystal hinted to earlier, sometimes people are so focused on getting through the procedure that they are not paying any attention at all to why their arm is hiked up a certain way or how far they're bent over to one side or twisting at the back to reach around to grab whatever they need to grab or to get on the computer, depending on the operatory. Every office is a little bit different, but that's actually one of the things that we teach a lot is that if you can actually just start paying attention to how you're moving, that is you're more than 50% there already because you're at least stopping the issue, which is you bending over. We can work on the muscles and the getting you out of pain and all that later. But if you aren't going to actually fix how you're moving on the day-to-day and pay attention to it, it doesn't matter how much other therapy or whatever else you want to do. It's not going to be enough to stop you from bending over 40 hours a week.
Yeah, and I totally understand what you're saying about getting so involved in the procedure, because I know for me, sometimes I'm so focused on what I'm doing, I forget that I'm working on a person.
Yeah.
So it's just kind of, I can totally relate to that.
Yeah. And especially when you're newer in your career, right? As a student, especially, you are learning new skill sets. You want to do well for your patient. You want to meet your requirements. Like whatever it takes, like I will bend and move whatever way I need to get this done because I want my patient to be, they're glass. I need them to be, they're fine with me working on them, that I won't cause any issues. But I'm telling you, the earlier in your career that you can think about this, and just like what Matt said, at least have it in your mind to ask the patient to turn their head towards you, put their chin up, like just these little minute things that you can be requesting of the patient will save you a lot down the road. Because, statistically, it is very common for whether dentists, hygienists, to have issues with your back, your neck, your shoulders, your arm, your wrists, and these little changes ahead of time would really help circumvent that.
Yeah. So I know you're focused on the physical therapy side of things, but do you still see any benefit in seeing like a chiropractor or massage therapist?
What I will say is that, because it's funny, that's probably one of the most common things that people DM us is like, hey, I've been exactly that chiropractic and massage, that combination. Very, very common with a lot of dental professionals. And as I mentioned earlier, I think that they have a role on your team, but if we aren't fixing the ergonomics in clinic, again, which is the root cause of everything, it doesn't matter how many times you go. I've talked to some people who've been going for months. I legitimately have talked to a few people who have been going to chiropractors for probably 5 or 10 years consistently, and they still have pain. But the reality is that their dentistry is just poor. Not the quality of their work, but their posture at work. So again, we got to set the ground level first. Let's fix how you move in the clinic. And then we can figure out, hey, if maybe you do need that chiropractic adjustment, maybe you do need the massage. But honestly, with the methods that we use, we've been able to help equip people to be able to self-manage their own symptoms so that they don't have to keep running back. And I think that is just very much a difference in philosophy as far as the treatment mindset of a PT versus the chiropractic or massage. I know they're very much like, hey, I'll fix you up, but you have to keep coming back to me in order to get things fixed. Where physical therapy, we're all about putting the ball back in your court and saying, hey, I'll help you get there, but from here on out, you should have the knowledge to be able to manage this, even if I'm not there.
Right. Yeah, I think that's really important because massages feel good. I'm not going to say I've gotten them during that time where I was working 6 days a week. It became a priority in the budget because it was just like, for my physical well-being, I need to do this. However, it is very passive. So meaning that in that moment, it can feel helpful. Maybe a couple days later, it can feel helpful, but then you're right back to where you were. You were not empowered to do stuff on your own to be able to fix the root cause of what's going on so that you don't have this ongoing issue. And that's where I think in alignment is so crucial, because we do marry the two so well, where yes, you are going to feel better, but in addition to that, we're empowering you so that you know what to do. So even after you stop working with us, you can still remember what you learned and you can fix your posture or change your ergonomics as needed.
And one more thing I'll add on to that. The reason that I still think it's great to work with a professional, like I said, an alignment PT, but really a lot of folks are doing things in a very generic way, meaning that you may have the general idea and understanding of, hey, if I do yoga or if I do chiropractic or get a massage, I know that those are general things that get me out of pain. But the reality is that every single person is going to have a unique set of muscle imbalances, meaning that maybe some muscles are firing too much, maybe some are firing too little. Maybe they have a history of certain types of injury, or I've been chatting with some people in the DMs on Instagram that they talk about how they're hypermobile. And then I even asked them, how are you getting out of pain? And it's like, you have hypermobility, but then you spend all day stretching, which makes you more mobile. And then you go to the chiropractor, which makes you more mobile. So it's one of those things where people sometimes need that guidance to put the pieces together and realize that just because this is a generic, hey, I know these things tend to make me feel good, that doesn't necessarily mean it's the right thing for you. So that's why it's always best to get assessed first, so we can say, hey, what imbalances actually do you have going on? What is your history with PT or with just injuries in general? Do you have a sports injury from when you were a kid? Two people can have the exact same pain, by the way, and it can be for a completely different reason. So always get assessed first if you want the more specific solution, which is the long-term fix.
And that's something that I'm learning too about in general, working with specialized people such as dental hygienists or dentists or physical therapists, is that we're trained in a specific area. So we're able to see things that someone who's not trained in that area wouldn't see. They just say, oh, my shoulder hurts, so I must need to do stretches or something, when maybe that's not the right protocol. So the next thing I wanted to ask you about was dental chairs. I know some people have like their favorite chair and they're like, this is the one for me. I know the saddle chairs are popular with some dentists and hygienists. So what do you think about the dental chair? Does it matter what kind we use?
Do you want to go first? You want me to go?
Yeah, I can go first. So, I would say it's really based on your preference as well. So, for example, I tried different chairs. So I did try saddle stools, different operatory chairs. Some operatory chairs have armrests, some don't, so there's a lot of variations in the chairs. but it's really based on, one, your preference and what you like. So me personally, even though I know a lot of people love saddle stools and I think they're great for your posture, it just was not ideal for me. It just didn't work for me. However, I was able to be fitted in a chair that was more conducive to my body type, very small. So my body type, that I feel like I could be comfortable while I was practicing dentistry and still be in ideal posture. And it's very important to be fitted and to really try these chairs. I know sometimes people just buy stuff off Amazon and they just go sit on it. And it's like, just because it's a saddle stool and it's supposed to be good for your posture, if you're not accurately adjusting it, it can actually have the opposite effect. What would you add on to that?
Yeah, I completely agree. They definitely are great tools to be able to use. But again, some people sit more, some people stand more. Mm-hmm. It really just depends on the types of procedures that you do. But then also, are you working solo? Are you working with an assistant? Like, how tall are you in comparison to your assistant if you're working with one? All of those different dynamics play a role on if it makes sense to get a saddle chair or not. Or if you do get one, which one do you get and how do you need it to adjust?
All right. And I've been looking on your Instagram a little bit, and I've been seeing how you do trainings and stuff like that. So talk a little bit about that and the different forms that you can get training in.
Oh, sure.
Good.
Yeah. So we actually started locally. That's actually how the business got going. We just went to different dental clinics around town where we live, and we would just say, hey, these are some of the statistics about dental professionals in the field. Just in case you guys don't know, right now it says 1 out of 3 dental professionals, regardless of where you are in that system, will retire early due to disability from the act of practicing dentistry, which is really high. So obviously you're still in school, so, still even just getting there. But I always tell students when I talk to them, like, hey, look to your left, look to your right. If you don't do anything to protect yourself in order to have good posture and ergonomics, a third of you are not going to be here in 20 to 30 years. We're just keeping it real. It doesn't matter how much money you spend on your degree. It doesn't matter how much you were invested. You have to take care of yourself. And that 30% of people who walk away early are the 30% of people who say, oh, what's the big deal, until it is a big deal. We would do lunch and learns for a lot of clinics. So I'd actually walk through the clinic for probably an hour or two and just observe everybody from the office staff to every single person that was doing any sort of procedure at all. I'd get pictures of them so I could actually catch them in real time and just say, hey, this is what you look like when you practice dentistry. I don't know if you knew that. And then
those are always fun.
Yeah. People
yeah.
Caught in 4K. Like,
exactly.
You can't play with the picture.
And once we did that, we would just bring up the lunch and learn. We talk about different techniques that they could do. And really just what is the lowest, or what did they say? Like minimum effective dose of what you can do in order to protect yourself. So we're all about teaching people how to do things first without equipment or with very minimal equipment, exercise-wise. And then we branch out from there. Depending on the needs that the person has, we'll say, okay, maybe you need something that's a little bit more in-depth here. But once we figured out how to do that in person and we saw enough offices, we figured, hey, I think we could take this online. And we actually did develop a strategy where folks are still able to get us all those images. And we actually have people do a posture analysis that we walk them through exactly how to capture all the images of things that we need to do that way, or videos of them moving certain ways. So that way, because we've seen it in person, we already know, hey, looks exactly like when I saw this when I was in this office. Here's the best solution there. Or, hey, I'm noticing with your posture images that you're sending us, your right shoulder is significantly higher than your left, or maybe somebody has a foot that's always turned out one way and that throws off the balance of the ankle, which PT jargon, but it goes all the way up and down the chain. So if one joint is off, it'll knock everything else out of alignment. And we coach people through 90-day programs that are specific to them. And the cool thing about that, we have not had one person who's gone through our program and actually do what we say that has still had the same or any pain when they finish with us in 90 days. It's most people can't give 100% success rate, but really our system works. It's up to you. And as long as you do your homework, you will get better.
And I will say too, to add to that, I mean, we've had people who may not have done everything that we have suggested, but still have gotten results, good results from working with us. And going back to what Matt said, so yes, we did do quite a bit of things in person initially. and then have transitioned online, because this is such a void, I believe, in the dental profession, that a lot of dental professionals understand. Like when you say postured ergonomics, we all make jokes. We all know that we need to be doing better. Like you can think of yourself and you can picture yourself with your patient doing something you shouldn't be doing. And we know it's good, but sometimes we're not willing to take that step to do something about it so that we can consistently have good ergonomics and posture, because it's possible. We can't just say, well, dentistry, it's just what it is. No, like you really can. And when we started taking things online, we've actually done lunch and learns virtually as well, because I do think that ergonomics is not in isolation, right? Whether you're the hygienist, the dental assistant, or the dentist, you work together as a team. And in so doing, when the whole office is more aware of their ergonomics, then the entire staff thrives together, right? Now, that being said, of course, like Matt said, we do work with people on a one-on-one basis individually, and we're able to customize it based on whatever imbalances that you have and work more deeply in helping you find solutions so that you can prosper in what you're doing at work. But I really do value that team approach as well, so that many members of the team can be more aware of this so that we can work together and all get better together.
How easy do people find implementing the strategies that you offer?
I would say it's quite simple. Again, our program, it's really, if as long as you're actually doing what we tell you to do, you will get better. Mm-hmm. So it's one of those, the biggest factors that we've seen. One is, what is somebody's relationship with actually taking charge in their own self-care? Mm-hmm. If people are used to just doing everything passively, sometimes they have a little bit of a harder time on the front end, and it takes them a little bit longer just because they have to take that control back over their own health, really. Mm-hmm. Also, people who just in general, if you've been more physically active, a lot easier to implement an exercise program that way. But we help with that. It's all about mindset as much as it is about learning the skill set of being able to care for yourself.
Yeah, think about it. As a hygienist, you get this more than anyone, because I feel like with patients, we often tell them, this is the conversation I had today at work, right? Like, yes, you need periodontal therapy. You need that deep cleaning. And we can help get that calculus and that plaque off. But if you do nothing at home for the next 3 months and you come back to see me, everything is still there, right? So there is a responsibility that the patient has to go home and do the things that we are recommending so that they can see improvement. They don't have the bone loss. Their gums look healthier. They can start having an upward trajectory, right? In the same way, we can tell you the things. We can tell you the imbalances. We can recommend an exercise program for you. And we don't expect you to, come out the gate. Some people do, but, come out the gate and just start doing everything 100% perfect. And, 7 days a week, you're doing everything that we say. No, sometimes we tell a patient, if they don't brush or floss, can we start with 3 days a week? Can we start with 2? Can we start somewhere and then work our way up? In the same way, if you're not used to working out or, doing some stretches and stuff like that, let's start off slow, and then we work our way. We help people problem solve and get it to be a part of their daily life, because this is not something where it's just a short-term thing that you're only doing for a few weeks. It's your life. It's your career, right? And it's something that you want to be able to build a habit to do long-term.
Yeah. That reminds me of, last thing I'll say on that. I'm not sure if you ever heard that phrase where they talk about anytime you're in a crisis situation, you never raise to the occasion. You actually always sink to the level of your training.
Yes,
So in the same way, when the dental clinic is getting really, really busy, you just got to get through all these patients. Guess what? The reason that it's hard to maintain good posture is because you haven't trained for it. But if you trained for it, it would just be just another day, and you wouldn't have those issues.
Yeah, that makes a lot of sense. What kind of feedback have you been getting from your clients that you've been training?
Smiles.
I know. Yeah, a lot of appreciation. I really think that when people take the leap and believe in themselves and really want to do something about it, and it's not necessarily, of course, we do help people who are in pain, right? Like if you have chronic pain, something going on for 12 months or longer, a shoulder that's hurting, your back is tight, all of that. Yes, we want to help you and give you the tools and resources. But we've also been working with individuals that see the writing on the wall. They want to be preventative, and because of that, they're willing to invest in themselves to learn things that are different so that they can train for it, just like Matt said, and be more prepared for whatever the future has for them. And it's just amazing to kind of see the light bulbs go off and just the appreciation of like, wow, I didn't. And let me tell you, people always say a picture is worth 1,000 words. When people see themselves, video or a photo, doing dentistry, and it's like, wow, I never realized I did that many times or whatever. And it's just bringing that awareness. Once you're aware, that heightens your ability to make adjustments and change. So it's been fun. It's really been a joy to take someone from just not really knowing that they should do something with their ergonomics and posture, but not knowing what. And then just to that heightened awareness and just joy again in practicing dentistry. It's not a drag. It's not oh gosh, the end of the week, let me try and figure out what to do with my body because everything hurts. But they can really get back to doing some things that they enjoy doing that they might have stopped because of the discomfort that they were having through practicing dentistry.
That all sounds very rewarding. I would think you get a lot of fulfillment out of doing this.
100%. Yeah,
absolutely.
So what would you give for advice for a dental hygiene student or just anyone who's new to the dental field in general?
I would start off with saying, I do think that, I know we're ragging on dentistry a little bit, but I think it's a great profession. Yes. I'll start off with that. Like, if you are a hygienist, a dentist, even a dental assistant, like it's a great profession to be in. Like, there is a lot of reward in helping our patients with their teeth, which is just so important in so many ways, like the health of their gums, all of that, right? All beautiful. And in so doing, though, for you to be able to do it long term, when you look at some of the older people in our profession, like maybe closer to retirement or so, I can't tell you how many stories I've heard with people who've had surgeries, right? Back surgeries, neck, whatever it is, because of these musculoskeletal imbalances and those repetitive motions that they've been doing. And now they're at the end of their career and they really can't enjoy retirement that much because they're so limited in their function. Mm-hmm. So going back to what I said earlier, prevention, we shout it from the mountaintops in dentistry, right? Yeah. We say, don't wait until the tooth hurts to come in to see us. If you even get an inkling, don't, I have patients, they come in for an ER and it's like, this tooth has been hurting for 2 years. It's like, what? How's it been hurting for that long and you're just now coming in for treatment? Or my gums. I mean, I'm sure you've heard, my gums have been bleeding for months, and it's like, no, when you start to see that something is not right, when you start to feel in your body that something is not right, let's see what we can do about it. So even as a student, I know it's so tempting to I just want to graduate, right? Like I understand, I've been there. I just want to graduate. I want to finish the competency. I want to get the passing grade. I just want to get that diploma and then move on with my life. And that's great. And I want you to be able to do that. And I want you to be able to do that successfully. But in the process of learning how to practice the form of dentistry that you're doing, let's think about our body as we're doing it. Do you really need to reach in that way for that instrument? Can you turn? Can you, again, like I said, ask the patient, move their head? Can we do these little things that will help us in the long run so that we can have a rewarding long career in dentistry, retire, and get to enjoy our life afterwards because our body is functioning well? So that would really be what I would say. Just really think about these things early and really don't wait until you're halfway in your career and you're wondering if you could even continue being a hygienist because everything is hurting so much. You have to stop and maybe switch careers, right? We don't want that for you.
Yeah, absolutely. And I guess one thing I'll say, another phrase that I've heard, I can't remember where I heard it from, but it basically just says, if you want to be exceptional, you have to be the exception. And that's true even for your career. If you want an exceptional career, it doesn't matter that everybody around you is not paying attention to their posture or just saying, oh, it's just part of the job, or whatever other excuse that people have to not do anything about the pain that they're going to be in. And that's exactly why they're going to be in that 30% of people who don't make it to the end of their career. Be the person that is willing to set the trend, to have that proper self-care, to have the good body posture, to take care of yourself before things get bad, so that you never have to deal with some of those things. Because the same people that were saying, what's the big deal now, will be the very ones that, like Krystal said, they can't enjoy their retirement. They had to get out of treating clinic hours and switch their career to something else or whatever it is. We can't stress enough that don't wait for pain to be the reason that you decide to do something. Just do it so that you don't have the pain to begin with.
Yeah, that makes a lot of sense. So I've got through all the questions that I was going to ask you, but is there anything else you wanted to share?
I mean, I think we covered a lot of subjects. If there's any off-the-cuff questions you had for us, maybe we might just need some prompting.
No, but I think you did well. Those are excellent questions. And I do appreciate you even sharing just some of the things, because you mentioned to us kind of some of the awareness that you had with your posture, and a situation you had with one of your patients where you were standing, if I remember correctly.
Right.
And go ahead.
Oh, I'm just agreeing. Yeah.
Yeah. You're standing, and I think you said it was for almost 2 hours, and then you started to experience discomfort in your knees like later. And that really heightened to you the importance of posture. And I know sometimes people ask, is standing or sitting better? And it's really both, like doing a variation of both. Yes, you can do hygiene sitting or standing, but we also have to be thinking about our posture in that process of how we're doing it so that we can prevent those injuries. So I think this is just an important topic for our profession. I think there's some great individuals who are in the field of dentistry and some people who had to make decisions to switch careers or maybe not being chairside because of the discomfort. So, thank you for allowing us this opportunity to really be able to share so that people can, like Matt said, take that self-care very seriously so that they can have a fulfilling long career helping many patients to come.
Well, I want to thank you so much for being on the podcast. I can tell you two are both very passionate about what you do. And, I think passion goes a long way. So, and I feel like working with you, that would transfer to the people that you're working with. They're passionate about it. So it's like it makes people want to do the techniques that you share with them. So, do you want to share with people where you are on Instagram or where else we can find you?
For sure. Yeah. We're mainly on Instagram right now. So just look us up at In Alignment PT. You'll see a picture of both of us, and that's how you know you found us.
That's great. Well, thank you so much. I appreciate it. And yes, if anyone wants to contact doctors, then you can. So thank you.
All right, thanks so much for having us.
You're welcome.
Thank you for listening to my dental hygiene school experience. You can find Dach on Instagram and TikTok by searching for dachska.dental. If you have questions for Dach, you can send him a message on Instagram or TikTok, or you can email him at dachskadental@gmail.com. Our host is Dach Ska, and I'm the announcer Nigel, telling you to stay nerdy and brush your teeth.